Yeah, always on the run. Don't have time to stop.
What are we going on, Chief?
We're going on a core zero, which is somebody who's not responsive, not breathing, and does not have a heart. Heart's not beating, so basically it's a CQI. I try to follow. Signed up for a job that we deal with everybody's worst days, and that's our everyday.
Sure.
Hey everyone, welcome back to the Aurora Fire Rescue YouTube channel. I am here today riding along with Battalion Chief Krenz, and there's a lot of pressure on me because this guy used to be one of the PIOs here at Aurora, so it's all eyes on him, and I feel like it's all eyes on me today. But super excited for today. Battalion 5 is the newly added Battalion Chief here at Aurora, and maybe Chief, you can kind of tell us about why Battalion 5 was added and the difference between Battalion 5 and the other 4 BCs that are on the street.
Perfect. Battalion 5 is our 5th battalion. However, we are a little different than a normal battalion chief in Aurora Fire Rescue, which is similar to a battalion chief in any other fire department. Our Battalion 5 specializes in EMS. Aurora Fire Rescue is building out our community medical branch, which is going to be our EMS division. And what we do is, instead of having 5 stations report to like a normal battalion chief, traditionally in the fire service, we oversee all EMS for our shift. We work the 24 hours, similar to any other battalion chief, but we specialize in EMS. We're the highest ranking paramedic. One of the differences in our department is if you're a battalion chief, you're a scope limited paramedic, which means even if you are a state certified or national registered paramedic, you're scope limited down to the EMT level because you're not currently practicing your paramedic skills. To become a Battalion 5, we have to rescope as a paramedic to keep our skills up, and we go on a lot of high acuity calls. An ASHER call, which is an active shooter call, an MCI call, any working fire and above, we're gonna manage the medical side of those fires. To enhance our medical response is a key priority of our department. And we've had recently, in the last couple of years, we've had multiple saves for fires. And actually, medically, we carry what's called a cyano kit, and we can actually save many lives by the use of that miracle medication. A lot of fire departments are using now. Another high acuity calls, like I said, ASHER's multiple casualty incidents. That's where we have multiple casualties, where we need a medical branch to help facilitate treating multiple patients that a lot of times can overwhelm an EMS system, a fire system, and also hospitals. So how do we take those patients, provide the necessary care, and distribute them to the hospitals in a proper method so that hospitals don't get overwhelmed? We still have the responsibilities of a fire suppression battalion chief. So I know some departments, once you go to EMS chief, they do not respond as a fire battalion chief or a hazmat battalion chief or a technical rescue battalion chief. We still do that in the city of Aurora. So I still have to maintain my ability to run a 3-alarm fire, as well as ensure that the medical branch is being run professionally, and also make sure we're treating the patients the best care possible for our cities, the citizens.
Sure. So kind of the best of both worlds as far
Oh
as,
yeah, I love it. It's been a great opportunity. When Chief Auden designed this program, it's been pretty cool. There's been 4 new EMS chiefs, 1 admin and 1 for each shift. I'm the B shift EMS chief. And what was really great is 3 of us volunteered. So it wasn't brand new battalion chiefs. We've been battalion chiefs for up to 6 years, down to 2 or 3 years. Then we've had a brand new EMS chief that has a different point of view. But we're also seasoned battalion chiefs. So we've been doing this job in a fairly busy city for a while.
That's awesome. So we were talking about getting the morning started. It's a little less than an hour into the shift now. How does your day start? So it starts with a meeting?
Yes. Well, first and foremost, we come in, we do our rig checks.
Sure.
One difference between us and a normal battalion chief in Aurora Fire Rescue is we carry all the medical kits of a paramedic, where the battalion chief trucks normally carry a BLS kit and an AED. We have the full monitor. We have the full capabilities of a paramedic in Aurora Fire Rescue. We go through all our normal checks like a normal battalion chief would with our air packs, but we also have to go through all of our paramedic equipment. Make sure our rig's good, and then we have an 8 o'clock meeting. And we have a command meeting with all our division chief and all the other battalion chiefs and have a plan for the day.
Nice. And then we just sat down to talk about rescue staffing.
Yes.
Yeah, so Tell me about the rescues.
The rescues, Aurora Fire Rescue has 4. They're basically, I don't want to say pickup trucks. They're pickup chassis with a utility box on the back, and they're ALS response units staffed with at least 1 fire paramedic and 1 fire EMT. And what they do is they work from 10 a.m. till 6 p.m. 7 days a week, and they're staffed with firefighters. And one of the jobs, how we use those is they're a great opportunity. If we have 4 rigs out of service, we can staff those MSUs or rescues, we call them. We can staff those to put them in place of the 4-person rigs, fire engines and ladder trucks, to enhance our response model. Battalion 5, this is Tony speaking. Oh, no. It was me, but I tried, but I'm over here fixing a flat right now on my truck. Yeah. Not much. I got a call from you. Really? Okay, perfect. I'll talk to you. Thanks, Cap. Bye. Multitasking.
Yeah, you are. So we got to bring our audience up to speed. What are we? What do you got going on here?
What do we got on up here? Another day as a battalion chief in the fire service. What happened was last night they got a flat. They had to change out the flat at the fire station. We brought to our shops, our tire shop here, and they're backed up right now. So they asked if we could leave the spare tire with the nail sticking out of it. So at the same time, we're getting multiple phone calls. So that's what it is.
So what are we going on, Chief?
We're going on a core 0, which is somebody who's not responsive, not breathing, and does not have a heart. Heart's not beating. So basically, it's a CPR call.
Okay.
So we're going with engine 7, rescue 7, which is one of those 2-person rescues, and a Falcon ambulance.
Okay.
So we're sending quite a few resources, but this is a critical call where if we get there in a timely fashion, what we'll do is we'll do CPR if warranted, just like a hospital would do. So we're bringing in quite a few resources, and we do everything that a hospital would do. You'll see us, if it's a medical core 0, we'll stay on scene for sometimes up to 30 minutes. And the reason why is when you're doing high quality CPR, if you have to carry a patient out to a ambulance or during ambulance transport, CPR is not as high quality.
Okay.
That's why we actually stay quite a bit longer. So Battalion 5, since we've been implemented, they add Battalion 5 to all core 0s, and what we are there for is basically just to help improve patient care by managing the scene, or if any critical tasks need to be done, we can help our paramedics who do a very good job on the scene. Sometimes one of the biggest challenges is just through traffic.
Just getting there.
Yep.
Yeah.
As we know,
Yeah.
say pull to the right.
People see emergency vehicles and probably don't give a lot of thought to what's going on inside of them and the purpose of what we're responding to.
Battalion 5 and Medic 106.
So unfortunately, this turned out to be an obvious death. We were unable to provide CPR. The outcome was not what we wanted.
Battalion 5, are you going to continue?
Battalion 5 is available. We've been cleared by crews because there's nothing we can do on that scene. They're going to handle with APD.
Okay. So we were just rolling up right now. We can see the rigs, the hotel over here.
Yep, and crews made patient contact and the patient was not viable for CPR.
Okay.
So that means that, has been passed away for quite some time.
Okay. Yeah, so your role as Battalion 5 is different than the other battalion chiefs, but especially with the focus of EMS, something our community members may not think about a lot. What's that, mental health, emotional toll like for a person who has to respond to all these, a lot of them really terrible calls, people who don't make it. There are some who do make it. We're celebrating one of those this afternoon.
Yes.
But a lot of them don't.
One of the great things of our job, right?
Yeah, right.
It is. I mean, that's one of the things, like, a lot of people don't, I guess until they actually see it themselves. First responders, we deal with, and we enjoy doing this, but we signed up for a job that we deal with everybody's worst days. and that's our everyday.
Sure.
And so our crews just went on unfortunately somebody passed away. Somebody passed away, and that's just a horrible call. Somebody passed away in a hotel room. So
Yeah.
who knows what kind of toll that will take on the crews over their lifetime of their careers.
All right, so after that last call that we got canceled from, we came to fire headquarters and went to a CQI meeting. What is a CQI meeting?
It's a continuous quality improvement meeting, and it's where bi-weekly all of our medical directors, our partners at Falck and their management team and training team with our community medical branch meet up, and they review usually about 6 calls, but it can be as much as 8 calls, and they're interesting calls where either, and they're usually difficult calls, usually where the crews, it can be calls where the crews did a really good job, it's the kudos, or maybe an incident where calls where crews from Falck and AFR had extremely difficult call, complex call, and some training may need to be done. So all the doctors and the heads of Falck and AFR's community medical branch discuss, and then sometimes kudos are given out, or sometimes we just do some training on those difficult calls.
Okay. And now, so we got lunch to go from the cafe there at the Municipal Center, and where are we headed now?
Yeah, always on the run. Don't have time to stop. We're going to Station 4 for, from our previous call, we were actually going on where possibly needed to do CPR, which unfortunately was not the case. But we're going to what's called a Phoenix Award. And a Phoenix Award is when AFR and Falck crews did CPR on an individual, and they got ROSC, which is they returned their heart pumping again and their lungs breathing, and they went to the hospital, and they walked out of the hospital neurologically intact. So it means with the effort of the community members, our department, Falck, did their job and did a great job, and the person is alive today because of their work.
What we're here for today is to recognize you guys with our Phoenix Award. Okay, our Phoenix Award is represented as an award we give out when you guys have a cardiac arrest survivor in the pre-hospital environment, and you were able to restart their heart. But not only doing so, you're actually able to get them to a point where they're able to be discharged from the hospital neurologically intact. Okay, that's a huge thing if you think about it. Of all the things that we do that really make a difference in someone's life, the fact that someone's heart is stopped and we're able to get them to a point where they're able to be discharged and be able to return to their families, return to their homes, return to their community is a big thing. It's really kind of the ultimate thing that we can able to do for someone in our life. And you guys practice a lot to be able to do that, and that's why exceeding those national averages is really important for us. One of the big things, the chances of having an intact, neurological intact survivor in the out-of-hospital environment is about 7%. Okay, so 92% of the time we don't have those kind of outcomes. But when we do, we really want to celebrate those outcomes because they're a huge thing. And this year, you guys are really killing it this year. Not to speak, bad choice of words, but you guys are really doing a really good job. We're having I think over 12 in the first 3 months of the year. That's a really good track record to be on as far as how well you guys are doing this year with these correct survivors. So congratulations and thank you all your work you're doing. It's not just one thing that has to happen between what you guys are doing, not one person that made that difference. It was really that whole team had to work together and get all these things done in a really timely manner. Because you only got about 4 minutes to really make that impact before someone starts having neurological damage in their brain.
Thank you.
Congratulations. 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 Congratulations.
Thank you, Dr. Hill.
All right. So let's get a quick picture with those awards for our recipients for this call.
Where are we going?
We're responding with engine 9 to a motorcycle versus a vehicle. We don't really have a lot of notes on this call, so we added on. These calls can be either very critical with the motorcycle accident, could be have multiple patients. So we're just going to go and see if we can help out. If it turns out to be not very critical, we can clear. All right, so what happened was I just canceled off the call because per witnesses, the motorcycle drove off. Vehicle stopped and a motorcycle rider and a vehicle rode off. So sometimes that happens. So that's why, actually, it's a great point. If you see us driving emergent to a call and automatically just turn off our lights, the reason why sometimes is the call's been downgraded. But what I really want to show you is why we don't want to go too far and bury the blade, and why we also want to use this properly, the proper lift technique. Because what happens is, and has anybody shown you this before? If we bury the blade down there, what happens is the angle of this blade makes it for the anatomy where we're using the bougie as an example. What happens is it can't make the corner up into the vocal cords. So it's automatic, you're fighting it. So you'll see this a lot where it pushes down and it goes wrong way. Anyways, so that's one way. So we had a lot of our air track. We used to use a method more of like I used to rotate it like this. Same thing happens. It's a muscle memory because we get muscle memory to do it. So same thing happens if you rotate like this. It's going to push the ET tube or the bougie or what have you all the way down. It's going to be too low, so we can't make the angle back up into the airway, the vocal cords. So that's a couple of the things we're seeing. So. Yeah, perfect BSI, seat safe.
It changes the feel of everything.
It does, doesn't it? You're motivated me that you got all the equipment on.
But I like the way you show this in the middle.
You like this method right here?
Preloaded with probably like yay much out,
Okay.
so you can just grab it and send.
Perfect. So does that make sense? So don't bury the blade, go midline. Make sure proper placement. You want to see the vallecula. In the video screen, the vocal cord should be in the top half. If they're too close, you're not going to get the angle. And if you're rotating your hand, you're not going to get the angle. You have to lift up. So that's kind of where we're at. And we want to be suctioning. If you guys just want to practice each way, each method, as many times as you want, just to get comfortable. Or there's that method too, through the suction.
Good. Yep.
Send the tube. Good. There we are. Miss. Lung sounds, please. All right.
Preoxygenating.
You need good communication in your team too. Somebody's going to be sliding over, so make sure you have a good team that knows what they're doing.
All right. Preoxygenating. I can get in suction, and then we'll go for the tube with just bougie.
Cool.
Ready?
Ready when you are.
1, 2, 3. Suctioning. We are a little deep. There's a vallecula. Good view of the cords. Past the cords. Can you drop my tube on, please?
You bet.
And go through. We are through the vocal cords. Good there. Pull the bougie. And inflate the cup.
Inflated?
Yep. Light block is stuck. There we go. Alright, two. We're pre-oxygenating. And pull that against suction, and then we'll go for two. Ready? 1, 2, 3. Suction, suction.
And you have
For
your
head
pressure
tunes.
right here.
Good view of the vallecula. There we go. Good view of the cords. We are through the cords. That's that.
Yep.
Through the
Take
cords, yeah.
pass.
Once I come back a little bit. There we go.
Tube, go ahead and secure it.
Flex and blade. Cheered. One sounds.
Tom, we'll follow you as a passenger. This is Battalion 5. Battalion 5.
Battalion 5, you have Engine 11, Cat 1, and Basic 509. Responding, Dog 6 is attached to the call, not en route yet. This would be a 62-year-old male, conscious and breathing, not completely alert. Been browses on one side, started 30 minutes ago.
Battalion 5 copies notes, thanks. So one thing we do, if you ever see battalion chiefs or smaller vehicles, usually we follow the bigger apparatus. And some of the people may not know this. It's because people move out of the way for them much easier, and it's safer for us to travel behind them. As you can see, they'll get out of the way here. I try to follow them. So on these calls, what will happen is our paramedics are going to do a primary assessment of the patient, and we have a protocol that if they meet the requirements, the University of Health stroke ambulance, which is already on scene, can take patient care and start treating the patient as a stroke. If they do not meet the requirements, what will happen is our crews will go ahead and transport the patient with the normal protocols. So that's kind of what will happen. It was pretty neat that the stroke unit was on scene first, so they initiated patient care, and kind of the standard stroke test is called the Cincinnati stroke test. That's what most EMS agencies, that's what we do. What's interesting about that, the stroke nurse has a higher level of training, so she can do higher levels of care. There was no deficits found, so at that point they handed the patient back over to us, and we're going to treat them through our protocols, and they're going to return to service. Okay. So I basically got added on to an MVA involving a city employee. So that's kind of our practice at a battalion chief. I was the closest battalion chief in the area. So we're responding out with Engine 11.
And your patient weighs 200.
With the possibility of having multiple patients, we added a second ambulance.
5 greens total.
5 greens total? Okay.
These 3 were in one vehicle, and then I had Phelps checking on another one that's most likely to be a refusal.
For a rollover crash in North Scranton Street and East Smith Road. Battalion 2, Ladder 2, and Engine 3 for a rollover.
Can you add me to the suicidal party with Engine 4, please? Thank you. So I'm going to request a mobile response team or a critical response team, and to help with the mental illness side of it, possibly.
You can go in service.
So that's why I asked to have them respond if they're available. Okay. So it's kind of the goal, see if they can come out to the scene and assist us with the evaluation of the patient to see if the patient better needs treatment that they can offer through their channels, or if it's through an emergency room, emergency department through our channels.
Nice.
So that's what I'm kind of working on. Some of the thought process when we go to these calls. Dispatch, this is Battalion 5. I'm in service too. If APD wants to come back, they can call us. I would still request AMRT if they are available and they might want to go out. So we got canceled on that call per the RP. Our dispatch, I don't know if you can hear, they're going to keep PD going in. If they do deem that there's the person's having a suicidal ideations of any sort, they'll call us back. Or if AMRT goes on scene, and if they can handle it, they won't call us back. If they need to call us back to assist them, they will do that. So that's the plan moving forward. But at this point, we're not going to stand by and stage waiting on APD to determine, since the person who called 911 said there's no problem now. So that's our decision-making capacity on that.
Sure.
Decision-making process, not capacity.
Yeah. What does AMRT stand for?
It's Aurora Mobile Response Team.
Okay. And how are they staffed? What do they do?
So they're staffed with an EMT, and it's provided by Falcon. staffed by a clinician who's a medical professional who actually can do determination if somebody gets an M1 hold, and that's a mental health hold that medical professionals, police officers, or peace officers or judges or doctors can place in somebody. And that's generally when you hear about a 72-hour hold.
Okay.
Paramedics cannot do that. But they're trained at determining that the clinicians are at a greater level than us. They also they can send patients to other resources that may help them if they're not a direct threat to themselves. If they are a direct threat, they can put them on an M1 hold. We can take them to the hospital. But if there's other resources, it could be homeless shelters to a family's house. They can actually transport them to those locations. Pretty neat little program. So that's why I requested them.
Sure. All right, it is just after 8 p.m., so we just finished up 12 hours, giving you a view of what a day in the life of Battalion 5 is like. You still have another half of the shift left.
I was going to say, you're going home, so I got another 12 hours to go, and
I'm tapping out.
We're probably going to get busy as soon as you leave, right? So.
I have no doubt. I'm going to sleep comfortably in bed at home, and I'm not 100% sure that Chief Krenz is going to sleep through the night, based on how the afternoon has been. How often do you sleep through the night?
I don't know, about half the time.
About half the time.
So we'll see.
We'll roll the dice.
Yeah, exactly.
Yeah.
So it's pretty good, but no.
Well, I think I speak for our audience when I say thank you for letting me and letting them spend the day with you, riding along, learning about Battalion 5 and learning more about EMS at Aurora Fire. If you have any questions about what you saw during our ride along today that I can answer or that Chief Krenz can answer, drop us a line in the social media comments, or you can send an email to afdpio@auroragov.org, and I'll make sure that Chief Krenz gets those and passes along the information. This was a video suggestion that we got, so if you have ideas on where you'd like to see me ride along next, maybe it's even back here at Battalion 5, let me know, and I'll see you in the next video.
Thank you. You're welcome anytime.